Hi, everyone, and welcome back to Nurse Ally, your trusted ally for health and wellness insights. For those here for the first time, my name is Gabe, and I am a clinical nurse specialist, and my mission is to simplify health topics that can sometimes be overwhelming. Today, we're diving into an important yet often misunderstood topic: hospice care. Whether you're a caregiver, family member, or someone simply wanting to learn more, this video will give you the clarity you need. Let's talk about what hospice is, what it's not, and how it can provide comfort and dignity during one of life's most challenging seasons. Hospice care is a holistic, patient centered approach designed to provide comfort, dignity, and quality of life for individuals with terminal illnesses. Its focus extends beyond just the patient to include support for their families and caregivers. Hospice care isn't just about the end of life, it's about living fully, even in the face of a terminal illness. Let me break it down for you. First, hospice care is focused on comfort rather than a cure. For example, if someone has advanced cancer and decides to stop chemotherapy, hospice can help manage pain and provide relief from symptoms. Hospice care involves a coordinated team of professionals, each contributing their expertise. It's a team effort. You'll have doctors, nurses, social workers, chaplains, and even volunteers working together to meet both the patient's and family's needs. Each team member plays an important role. The role of a hospice doctor is to ensure that your symptoms are well managed. For example, if you're experiencing pain, they work together with other team members to adjust medications to keep you as comfortable as possible. If breathing becomes difficult, they explore options like oxygen therapy or medications to ease that discomfort. Doctors also focus on listening to your goals. What matters most to you? Maybe it's spending time with your family or enjoying peaceful days at home. Hospice care is tailored to meet those priorities. The hospice team doesn't work alone. They meet regularly to review your care plan, which includes input from nurses, social workers, spiritual advisors, and sometimes even volunteers. Everyone on the team is here to support you and your loved ones. Hospice nurses play a critical role in delivering compassionate care to patients and their families. The registered nurse case manager serves as a primary coordinator of the patient's care plan, ensuring that symptoms like pain, nausea, and shortness of breath are well managed while also educating families on what to expect and how to provide care at home. They act as a patient's advocate, liaising with a hospice doctor and the rest of the care team to adjust treatments as needed. Licensed vocational nurses support the RN by providing hands on care, such as administering medications, monitoring vital signs, and addressing immediate patient needs during visits. Certified nursing assistants focus on personal care, ensuring patients are comfortable and clean by assisting with bathing, dressing, and grooming. Together, this team of hospice nurses provide a holistic support, addressing not only the physical, but also the emotional and practical needs of patients and their families, ensuring dignity and comfort throughout the journey. Hospice spiritual counselors provide compassionate support to address the emotional and spiritual needs of patients and their families, regardless of religious affiliation or belief system. These counselors are trained to meet individuals where they are, offering guidance and comfort during what is often a deeply emotional time. Whether the patient practices Christianity, Judaism, Islam, Buddhism, Hinduism, or identifies as spiritual but not religious, hospice spiritual counselors provide a safe space for reflection, prayer, or simply meaningful conversation. They may facilitate rituals, help patients and families find peace with unresolved emotions, or connect them with local clergy or religious leaders if specific sacraments or rites are requested. By honoring diverse traditions and beliefs, spiritual counselors ensure that patients feel seen, respected, and supported on their unique end of life journey. Hospice social workers provide essential emotional, social, and practical support to both patients and their families, helping them navigate the complexities of end of life care. They assist in addressing emotional challenges such as grief, anxiety, or fear, often serving as a compassionate listener and source of guidance. Social workers also play a critical role in connecting families with resources, including financial assistance, community services, and legal support for matters like advance directives or power of attorney. They help families understand the progression of the patient's condition, mediate difficult conversations about care preferences, and provide tools to cope with the emotional demands of caregiving. By offering a holistic approach to support, hospice social workers ensure that patients and their families feel empowered, informed, and cared for during every stage of the hospice journey. The philosophy of hospice care is centered on the belief that every person deserves to live their final days with dignity, comfort, and peace. Hospice care recognizes that dying is a natural part of life and focuses on enhancing the quality of life rather than prolonging it. At its core, hospice embraces a patient and family centered approach, tailoring care to meet individual needs, preferences, and goals. It prioritizes managing physical symptoms, addressing emotional and spiritual concerns, and providing comprehensive support for both patients and their loved ones. By shifting the focus from curative treatment to comfort, hospice allows individuals to find meaning in their remaining time, surrounded by those they care about most. This compassionate philosophy ensures that patients are honored, respected, and supported throughout their end of life journey. Hospice care extends its compassionate focus beyond the patients to provide comprehensive support for families and caregivers. Recognizing the emotional and physical toll of caregiving, hospice teams offer education, tools, and emotional guidance to help families navigate the end of life journey with confidence. Respite care is a vital component, giving caregivers as much needed break while ensuring their loved ones continue to receive high quality care in a hospice facility or other appropriate setting. This allows caregivers to rest, recharge, or address personal needs without worry. Hospice also supports families in the grieving process, providing bereavement counseling and resources for up to 13 months after the patient's passing. By caring for both the patient and their loved ones, hospice ensures that no one feels alone, helping families find strength, comfort, and peace during an incredibly challenging time. Hospice care is designed to be accessible and affordable, ensuring that patients and families can focus on comfort and quality of life without financial barriers. Most hospice services are covered by Medicare, Medicaid, and private insurance plans, which typically include medical care, medications for symptom management, durable medical equipment like hospital beds and oxygen tanks, and supplies related to the terminal illness. Patients and families also benefit from the support of a multidisciplinary care team, all included under these coverage plans. For individuals without insurance, many hospice organizations offer sliding scale fees or charitable care to ensure that financial status does not prevent access to these vital services. By prioritizing accessibility, hospice care ensures that every patient has the opportunity to receive compassionate, comprehensive end of life support. Hospice care is uniquely flexible, meeting patients wherever they feel most comfortable and supported. The majority of hospice services are provided in the patient's home, allowing individuals to remain in a familiar environment surrounded by loved ones. For those needing more intensive support, hospice care can also be delivered in nursing homes or assisted living facilities, seamlessly integrating with the existing care structure. Dedicated hospice facilities are available for patients requiring specialized 24/7 care in a tranquil, home like setting. Additionally, hospice services can be provided in hospitals for patients who need acute symptom management. This adaptability ensures that patients receive consistent, compassionate care regardless of where they are, honoring their preferences and providing peace and dignity during their final journey. Hospice care revolves around individualized care plans tailored to meet the unique needs, preferences, and goals of each patient and their family. These plans are developed collaboratively by the hospice team. The care plan addresses every aspect of a patient's well being, from managing physical symptoms such as pain and shortness of breath to providing emotional and spiritual support. It also takes into account the patient's cultural, religious, and personal values, ensuring that care is respectful and meaningful. As the patient's condition evolves, the care plan is regularly reviewed and adjusted to ensure their comfort and dignity. By focusing on the individual, hospice care ensures that patients and their families receive support that is not only comprehensive, but also deeply personal and aligned with their end of life wishes. Understanding the truth about hospice care is crucial for ensuring that patients and families can make informed decisions during vulnerable time. Misconceptions about hospice often delay access to services, depriving patients of the full benefits of compassionate multidisciplinary support. By addressing these myths, families can see hospice for what it truly is: a service designed to enhance quality of life, provide relief from symptoms, and support emotional and spiritual well being. Dispelling these myths helps families feel confident in seeking hospice care early, allowing them to experience the peace, comfort, and guidance it provides. So let's get to these myths and debunk them. Some people think that choosing hospice means giving up on treatment, but that's not true. Hospice care isn't about giving up, it's about focusing on what matters most. Let's say a patient has advanced cancer. Instead of undergoing more chemotherapy, which might cause side effects like nausea and fatigue, they can choose hospice to focus on managing pain and spending time with their loved ones. That's not giving up, that's taking control of what matters to you. Another common myth is that hospice is only for people with cancer, but the truth is, hospice supports patients with all kinds of illnesses: heart failure, COPD, ALS, Parkinson's disease, and even advanced dementia. For example, a patient with severe COPD might enter hospice to focus on relieving shortness of breath and improving comfort, not just managing the disease. It's about meeting each patient where they are. Here's a big one. Some people worry that hospice care speeds up death. Let me reassure you, hospice does not hasten or postpone death. It's about making the process as peaceful and comfortable as possible. In fact, research shows that patients in hospice often live longer because their symptoms are managed and they're not undergoing stressful treatments. It's all about quality of life. People often think that choosing hospice means you lose all hope, but that's not true. In hospice, we shift the focus to hope. Instead of hoping for a cure, you can hope for meaningful moments, pain free days, or simply time to hold someone's hand. I've seen families find hope in the little things, like a final family dinner or laughter during a quiet afternoon. That's the power of hospice. One of the biggest myths is that hospice is only for the last days or hours of life. The truth is, hospice can provide support for months. When started earlier, it gives patients more time to experience care, manage their symptoms, and make the most of their time. Waiting too long can mean missing out on all full benefits of hospice. A lot of people don't realize that hospice care doesn't end when a patient passes away. It extends to the family. Families can receive grief counseling, join support groups, and access resources to help them through the grieving process. I've seen families find so much comfort in these services, It's an essential part of hospice care. Another myth is that hospice is only for the elderly. Hospice is actually for patients of all ages. There are even specialized pediatric hospice programs for children and their families. These programs ensure that young patients receive the care they need while supporting parents and siblings throughout an incredibly difficult time. Some people worry that hospice care is too expensive. The good news is, hospice is usually covered by Medicare, Medicaid, and most private insurance plans. This includes medications, medical equipment like hospital beds, and even services like counseling. Families are often surprised by how affordable hospice can be. By understanding these common misrepresentations of hospice, it can bring peace of mind when deciding to elect hospice for you or your loved one. There are many benefits of starting hospice early. One benefit is proactive symptom management. Early hospice care ensures symptoms like pain, nausea, and anxiety are addressed promptly, improving the patient's quality of life. Also, choosing hospice early ensures there is family support. Families have more time to receive education, counseling, and tools to navigate the caregiving process with confidence. Another benefit is avoiding crisis care. Patients are less likely to experience emergency hospitalizations as the hospice team provides proactive in home care. Lastly, time for planning. Early hospice care gives patients and families the space to discuss end of life wishes, resolve unfinished business, and create meaningful moments together. Hospice care is designed for patients with a prognosis of 6 months or less if the disease follows its usual course. It focuses on providing comfort and dignity to individuals with a variety of conditions, including cancer patients, those who have decided to stop aggressive treatments, or whose disease has progressed despite interventions. Advanced chronic diseases is another situation. Heart failure, patients experiencing worsening symptoms like shortness of breath, fatigue, or fluid buildup despite treatment. COPD or chronic obstructive pulmonary disease. Those are individuals with severe breathing difficulties requiring frequent hospitalizations. Kidney or liver disease. So, patients who are no longer seeking dialysis or transplantation. Neurological conditions such as Alzheimer's and other dementias. So, those in the late stages who need extensive assistance with daily activities or have significant cognitive decline. ALS or Lou Gehrig's disease. So, those patients facing advanced mobility and respiratory challenges. Parkinson's disease. So, those are individuals with symptoms affecting mobility, swallowing, or cognition in the advanced stages. And there's other conditions as well. Hospice also supports patients with terminal HIV or AIDS, advanced stroke, or other life limiting illnesses. Hospice recognizes that caregiving is physically and emotionally demanding. Families receive education, tools, and emotional support to help them manage their loved one's care effectively. Remember, respite care is also provided, allowing caregivers to take breaks while ensuring their loved ones continue to receive excellent care. When it comes to hospice, timing is everything. If your loved one has been hospitalized several times recently or struggling with symptoms like pain or breathlessness, it might be time to consider hospice. Starting sooner rather than later allows us to provide comfort and relief right away. I want us to discuss real quickly the signs that it may be time for hospice. So, patients with repeated admissions for the same symptoms or complications. Sometimes noticeable physical, functional, or cognitive decline despite treatment could be a sign. Others with increased pain, breathlessness, fatigue, or other symptoms that are challenging to manage could be a sign, also known as symptom burden. Or when patients and families prioritize quality of life over aggressive interventions. So, those are decisions to stop curative treatments. Sometimes, when a physician estimates a life expectancy of 6 months or less, if the illness progresses naturally, it could be a sign as well. Caring for a loved one in hospice is both a challenging and rewarding experience. It's important to remember you're not alone. Here are a few tips that can help. So, discuss your loved one's wishes early, including preferences for end of life care, living arrangements, and important milestones they'd like to experience. Encourage open communication among family members to ensure everyone is aligned and supportive of the care plan. Take time to understand your loved one's condition and the hospice services available. Attend educational sessions provided by hospice teams to learn how to manage symptoms, provide personal care, and recognize changes in your loved one's condition. Don't hesitate to ask for and accept help from the hospice care team. They are there to support you as much as the patient. Utilize respite care to take breaks and recharge without worrying about your loved one's well being. Spending meaningful moments with your loved one, whether it's reminiscing over old photos, sharing meals, or simply sitting together in silence, create opportunities for joy, such as celebrating small milestones or engaging in their favorite activities. Caregiving can be physically and emotionally draining. Ensure you prioritize self care by eating well, staying hydrated, and getting enough rest. Use hospice resources like counseling and support groups to address your own emotional needs. Work with a hospice team to understand the progression of your loved one's illness and the signs of decline. Discuss practical matters such as legal documents, such as power of attorney or living wills, and funeral arrangements to avoid last minute stress. Remember, the hospice team is there to guide you throughout this journey. Ask questions, express concerns, and lean on them for advice, reassurance, and support. Use their expertise to navigate difficult situations, such as managing complex symptoms or addressing family disagreements. Hospice care is about making the most of the time left. Share stories, create memories, and honor your loved one's legacy in ways that are meaningful to them and your family. I want to conclude this video with a closing quote for you to help inspire peace and tranquility as you navigate throughout this journey. Hospice care is not about adding days to life, it's about adding life to days. It's a journey of comfort, dignity, and connection, ensuring every moment counts for both patients and their loved ones. Remember, you're never alone in this process. Hospice is here to guide you every step of the way. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might need it. And let me know in the comments if there are other topics you'd like me to cover. Until next time, stay well and take care. Your health is in great hands with Nurse Ally.